Hello, my name is Lauren Moffett, and I am doing a slideshow presentation on Bordetella pertussis. Bordetella pertussis is otherwise known as the whooping cough, which I'm sure all of you guys have heard of once or twice before. Again, Bordetella pertussis, otherwise known as the whooping cough. Bordetella pertussis's etiologic agent is pertussis. So pertussis is just known as a very highly contagious respiratory disease, known for lots of uncontrollable coughing. Oftentimes, very violent coughing can occur. It also can cause breathing to become very, very hard. That's what it's known for. That's what pertussis is. So the whooping cough affects actually widely, basically everybody, all age human. You might think, I look at this word Bordetella, I do have 2 dogs, I think, more than likely this is a dog virus as well, but Bordetella in dogs is different than Bordetella pertussis in human. So any healthy human carrier is capable of getting the whooping cough. Characteristics of Bordetella pertussis would be that they are a rod shape. So it is a cocobacillus shape. It also is gram-negative. I don't know if you can tell in that photograph, but they're little small red shapes, which indicate that they are gram-negative. It also is aerobic, which means it can survive in the presence of oxygen. So I'm sure you can only imagine how easily transmittable that is. Bordetella pertussis is also a catalase, positive, which means that it can break down hydrogen peroxide into water and oxygen. H2O2 into H2O and O2. Bordetella pertussis is encapsulated. It also has filamentous hemagglutinin, pertussin, and fimbria, which all help pertussis to attach to the respiratory epithelium, which then, causes that bacteria to stick into your, tract and, cause it to work its magic and get you sick. And virulence factors of Bordetella pertussis would be the filamentous hemagglutinin, filamentous hemagglutinin, it's hard to pronounce that to me, fimbria, and pertussin. So those are what help bind to the epithelial cells in the upper respiratory tract. Once those are attached to the upper respiratory tract, toxins that are produced by those bacteria enable colonization. That then proceeds to interfere with the host clearance mechanisms. It's just what happens. And then the mechanism of infection for Bordetella pertussis would be through aerosol. Somebody coughs in the air and you breathe in that air. That's how it's, transferred, and that's the mechanism of this infection. So unfortunately, following an infection with the whooping cough, you are also susceptible to getting other diseases. And those involve leukocytosis, bronchopneumonia, lymphocytosis, and acute encephalopathy. So leukocytosis is the increased level of leukocytes in your blood. That comes from a soluble protein toxins that are released and just causes a bad infection. Bronchopneumonia, it's obviously just a form of pneumonia, lots of fluids in your lungs, just not a pretty thing. Acute encephalopathy is a functional alteration of your mental status due to systematic factors. So unfortunately, during the paroxysmal phase, which is the second phase of those symptoms, the cough is what can cause that acute encephalopathy, which is just lots of, oxygen leakage to your brain. So it can, cause some issues there. And then finally, lymphocytosis, which is from the pertussis toxin. They cause more lymphocytes to secrete. Therefore, there's just a more impaired entry of lymphocytes into the lymph nodes. Therefore, that's where that, swollen lymph nodes can come from. Bordetella pertussis has 3 phases of symptoms. The first phase being the catarrhal phase that lasts between 1 to 2 weeks. In this phase, fever, cough, conjunctival infection, excessive watery eyes happens. The second phase, called the paroxysmal phase, lasts about 2 to 3 months. This is when, on the second week of this sickness, lots and lots of coughing happens. This is where they get that word whooping cough for this bacteria. During this time, there is inspiratory stridor, which is the indication of collapsed tissue. Right above the vocal cord. That's what causes that noisy breathing, because sometimes your vocal cords actually get blocked a little bit. Your airway partially gets blocked a little bit. And then during that third phase, it lasts between 2 to 3 weeks. It's a convalescent phase. That's where, kind of symptoms tend to calm down a little bit, and eventually that sickness will go away. Similar to a lot of other sicknesses, Bordetella pertussis can be transmitted to other people very simply, such as, being in close proximities to someone, or, sharing a drink, maybe giving a person a hug or a kiss. It just can happen very, very easily, especially if you are in close proximities with somebody, and you're, kind of breathing and exchanging the same air. Lab tests that you are getting, or that you get for a diagnosis of Bordetella pertussis, would be the PCR test, which is a polymerase chain reaction test, a culture test, which is probably the most recommended for for confirming that it is Bordetella pertussis, because they're looking for something in particular. So the culture test, which is typically a little like throat swab, and they kind of, touch your throat and then put it through a couple of tests. They do have blood tests, but that tests for antibodies. And so it's kind of, pointless, because it doesn't test to see whether or not you have Bordetella pertussis. It just sees if you have immunity in your system, or have those antibodies in your system. So it's hard to guarantee whether or not you have that currently or not without a more for sure test, such as the PCR test or the culture test. Similar to flu, treatment for Bordetella pertussis includes just an antibiotic. Of course, unless you have further complications. Antibiotics, the one that's most recognized and most recommended for Bordetella pertussis would be the erythromycin. There's also ones that are azithromycin and clarithromycin. All of these are very well known to treat and heal Bordetella pertussis. For prevention, it's definitely very obvious. Similar to a flu, hygiene is very important. So keeping your hands very clean, keeping clear of other people who might be coughing in the area. If you are the one that's coughing, coughing into your arm or sneezing into your arm and not directly into the space of others. And then, of course, vaccination. So the vaccination that they offer for whooping cough starts at roughly 2 months old. That's the Tdap vaccination. The vaccination does last for a while. They definitely recommend boosters for this. What they call it is waning immunity. So essentially, when you first get that vaccination, it's, all very, very strong, so you're very, your body fights against the whooping cough really well when you first get that vaccination. And then as you grow and stuff, it kind of gets a little weaker and doesn't do as well. But it is very important as a small child to get this vaccination, because children and small babies are very prone to getting it and not getting it very good either. So definitely that immunity is important at a very young age. So in closing, Bordetella Pertussis has been around for quite some time. In fact, it was discovered back in 1906, but first recognized in the Middle Ages. Unfortunately, at that time, it killed 5 kids out of 1,000, which is a huge percentage. And that was mostly kids before they even turned 5. In fact, it mostly killed kids that were less than 12 months old, which is so terrible. It still is around and sadly can still cause death, especially to infants who are too young to receive the vaccination, or to adults whose immunity have already waned. But anyways, it was a great little project. This was a lot of fun learning experience. I really enjoyed reading about the whooping cough and getting new information about this. So yeah, but thank you so much for listening.